overall, Barrett's does increase the risk of cancer forming in the esophagus. But for most patients with Barrett's, the risk of ever developing cancer is very low. Most people with Barrett's will never develop esophageal cancer. But when we find Barrett's, we do monitor it, and we monitor Barrett's for progression towards cancer. So Barrett's can take some fairly typical steps towards cancer. So in the esophagus, it starts off as normal esophagus, and then the next step is plain Barrett's esophagus, which is what most patients have if they have Barrett's. It's just plain Barrett's esophagus. The risk of cancer with plain Barrett's esophagus is very low. And when there's plain Barrett's esophagus there, we monitor it with endoscopy every so often. So maybe every 3 years or every 5 years, we do an endoscopy and look at the Barrett's and take biopsies. What we're looking for is progression of that Barrett's, or we're looking to see if the Barrett's has taken steps towards cancer. So it goes from plain Barrett's to what's called Barrett's with low-grade dysplasia, and then what's called Barrett's with high-grade dysplasia. And then the next step is cancer. Most patients never progress along that pathway. So as long as the Barrett's is just plain Barrett's, the risk of cancer is low. As it progresses towards the next step, low-grade dysplasia, the risk of cancer goes up some. Once it hits the high-grade dysplasia step, it goes up significantly. And that's just one step away from cancer. So when we're monitoring Barrett's, we're looking for that progression to low-grade dysplasia and high-grade dysplasia, which is closer to cancer. When we find those steps, the low-grade dysplasia and high-grade dysplasia step, we then start talking about treatment of the Barrett's. We then consider eradicating Barrett's, trying to get rid of the Barrett's to prevent that progression towards cancer. And we do that all with endoscopy. And it's a very effective treatment. It's non-surgical. It doesn't involve an operation. But because that risk starts to increase once we hit those steps of low-grade dysplasia and high-grade dysplasia, that's where we start to think about treatment, and where we typically recommend trying to get rid of the Barrett's before it has a chance to become cancer.